Okay, so this is video 2, and this is restoring an implant with digital components here at Midwestern University. These are the components I'm going to need out of the box, and I'm going to go through essentially each component again, and then what they do, and then also how to do the scan in the clinic, so that way you can send this out to the lab for an abutment and crown to be made. So let's take a look at the components. So this is your patient. This is the patient that's going to come in. As you remember from the first video, we're restoring tooth number 5. Obviously, there's 2 other premolars here, so this would be the 3rd premolar due to space, in an actual case here in the clinic. And then you're going to have these 4 components. These components, in some way, are what you need. The first one is the lab analog. The lab analog is essentially the implant that you guys placed 4 months ago or so. And that is going to go into the patient. So you're going to put that into your model and make sure it's all the way down into the actual position. And then the next thing you're going to do is you're going to grab this, which is your hand driver. And you're going to put that off to the side there. And then you're going to actually grab the next part, which is your healing abutment. So we're replicating what the patient will be when they come in. Now, if this is a 1-stage surgery, the patient had the implant placed, and then on that same day, you place the healing abutment. So we're going to say that's what happened. On a 2-stage surgery, then the implant is placed, a cover screw is then put on top, and then the tissue is allowed to heal over and underneath the bone and tissue, giving it more time. And we'll make a video or have a discussion about that on 1-stage versus 2-stage at some other time. But essentially, when you're going to see the patient 3 to 4 months later and they walk into the clinic, they should be walking in with an implant placed by you or one of the surgeons, and then also a healing abutment on top, which was a 1-stage surgery. Or if you did a 2-stage, you expose the implant, you place the healing abutment, you let them heal for 2 to 3 weeks. Okay. So they walk in. Now we're going to actually scan the patient and then send this off to the lab. Very, very simple. So in the video that I'm going to post after I stop talking here, which will come up, you're going to see exactly the scan insert that you need, how to set it up, what to scan, and what to send off. So before we do that, I'm just going to talk about this next part, number 4, which is the scan adapter. So when the patient comes in and you get your start checks and everything's going, you're then going to access and remove the healing abutment. Okay. So you're going to remove the healing abutment. And just so you know, see how I'm only using the driver and there's no torque wrench around here? Never, ever, ever use a torque wrench for any of these components. The only time you use a torque wrench will be in a video farther down the line, which is final abutments that need to be torqued to their representative Newton centimeters of that implant system. For DO, it's 35 for regular wide and 20 Newton centimeters for anything of a narrow variety, a 3.0 or a 3.3. So always remember that. So, okay. So patient walks in. They got a regular, looks like a 4.0 implant. And here at that tooth number 5, they came in with their healing abutment. We removed it. Now, in the video that follows is going to show the steps on how to use scan, and I'm going to tell you about that. But once we get all that situated, we need to put this part on. This is a scan adapter. That's what DO calls it. We also call it a digital scan impression post, a digital scan post. Sometimes you'll see it called different things. Now, each company will have their own version, and they'll have basically this cylinder, and then on it will have some type of geometric shape, most often a square or a rectangle or a slope, that basically tells the computer that they're going to set up the case with, 3Shape or exocad, where this is. This is going to translate to the implant that's in here, right? So we put this on, we scan it, we send it to the lab. They make this model and then place that digital analog inside. So this is why you want to send this information to the lab, and you want to make sure that it's done correctly. So the biggest thing with DO is that making sure that we back this screw up. So see how the screw's all the way out? We don't want it all the way out for DO, and really you don't want it out for most systems. You want it just barely out of the hex. Let me see if I can do this so you can see it. Okay. So, and then when you put this in, you want to make sure that the hex, let me see it, engages the internal hex of the implant. So the patient is sitting back. We're going to take this and we're going to put this down into there. And we're going to, whether we're using cotton pliers or anything, we're going to turn that until it drops in. And you'll feel it drop in and you can't move it. Like there's no screw engage, you can't move it. If that is that, the screw's backed out, then you're going to come back with your driver and you're going to tighten it down. And the way I do it, so is I put one finger on top to stabilize, one on the side to kind of stabilize that as well. So you always get in the habit of doing it, and then if you're, I'm righty, so you do opposite, and you just spin, 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 right? Spin, 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 until it tightens, and then you're going to do a one little quick tight, and then I'm going to try to hold this in so it doesn't pull out. And then, so that is the scan post ready for scanning, so that way you can send the lab. And again, as soon as I'm done with this, you're going to see a video that pops up and goes through all this. And actually, that will be the next video. So that's how you want it. And essentially, obviously, you can't do this in the mouth, but I want to pull this out and show you. So right here, you can see, back it up just a little bit. There's a little gray, like real shiny round thing against the implant. Right? You got that matte gray that leads to the shiny. You want that, okay? What you don't want is sometimes if you have the screw all the way out, like that, and you go to put that in like you're trying to find the implant with the screw, and then you go to screw it down, the screw will tighten before the actual implant engages into the hex. So see, it's tight right there, but if I pull it away, you can see how big that gap is now? That means this isn't all the way down. And if this isn't all the way flush to the implant in the mouth, like that, then your implant crowns are going to come out hypoocclusion, okay? And you're going to have to send back and have it remade. So you're going to see here, and another way you know that is, see how it's spinning? It shouldn't spin like that. It shouldn't spin as you're doing it, okay? So I'm going to back this out, okay? The screw's got to be all the way out, like I said. See how it's just right to the edge? Then, when you go place it in the mouth, you're going to spin it until it drops. And so once it spins, it drops, now it's in. If not, you can inadvertently tighten it right there, but it has to be down. As soon as it's down, then you're going to hand tighten, right? Obviously, you can't do this and take the implant out of the mouth. Patient wouldn't like that, but essentially that is what's happening underneath here in the tissue. So really pay attention to that. And how you confirm that it's down is that you take a vertical bite wing so that it's parallel, or perpendicular, I guess. It would be direct perpendicular, so you can actually see the platform. Make sure you're taking vertical bite wings, because a lot of times when you take bite wings, you just miss where the implant is, depending on if it's subcrest a little bit. And here's a photo showing the difference between an implant that's down on the x-ray and an implant that's not down on the x-ray. Okay, so once you have that, now you're ready to send this off to lab. And now following this, you'll see the next video, which is actually me setting it up in CEREC and then getting the right scans and then how you would treat it to get the scans more efficiently. Okay, if you have any questions, come see me.